Our second bedtime lesson is about warts and verrucas. Now we're going to start off with warts. Warts are small lumps that often develop on the skin of the hands and feet. They vary in appearance and may develop singly or in clusters. Most people will have warts at some point in their life. They tend to affect children and teenagers more than adults. Causes of them. Warts are caused by certain strains of the human papillomavirus, HPV. There are lots of different strains of HPV, and these cause different types of warts. HPV causes too much keratin, a hard protein, to develop in the top skin layer, epidermis. The extra keratin produces the rough, hard texture of a wart. Now, how does it spread? HPV is passed on through close skin-to-skin contact. It can also be passed on indirectly by contact with contaminated objects, like towels, shoes, areas surrounding swimming pools, and the floors of communal changing areas. You're more likely to get infected if your skin is wet or damaged. Warts can also be spread to other parts of your own body. You can spread the virus if you scratch, knock, or bite a wart. Bite your nails or suck your fingers, even if they have warts on them. Shave your face or legs. After you become infected, it can take weeks or even months for a wart or verruca to appear. When to get help. Warts and verrucas aren't actually usually serious and can be treated by a pharmacist. Your pharmacist will give you advice about the best treatment for you. Types of wart. There are quite a lot. There are 6 different types of warts. These vary in size and shape. Common warts, filiform warts, mosaic warts, periungual warts, plain warts, and verrucas. Treating warts and verrucas. Warts usually clear without treatment. The length of time it takes for a wart to disappear will vary from person to person. It can take up to 2 years for the virus to leave your system and for warts to disappear. They tend to last longer in older children and adults. Leaving the wart to go away by itself is one option, but you may want to consider treatment if your wart is painful, in an awkward position, and causing you to distress or embarrassment. A wart will sometimes return following treatment. Types of treatment. Common ways to treat warts and verrucas include salicylic acid, available from pharmacies in creams, gels, paints, and medicated plasters. Cryotherapy, liquid nitrogen is applied to the wart to freeze and destroy the affected skin cells. And chemical treatments. They are applied to warts to kill off any affected skin cells. Surgery is not usually recommended for them. Preventing them. There are steps you can take to lower your chances of getting warts and prevent them spreading to others. Here are the do's and don'ts. Do's. Keep your feet dry. Change your socks every day. Take care when shaving. The virus can easily be spread if you cut yourself. Wear gloves when using shared gym equipment if you have a wart on your hand. Wear pool slippers or flip-flops in communal changing rooms and showers. Cover the wart or verruca with a waterproof plaster or verruca sock when swimming or while doing PE at school. And don'ts. Do not touch other people's warts. Do not share towels, flannels, or other personal items with someone who has a wart. Do not share shoes or socks with someone who has a verruca. Do not scratch or pick a wart or verruca. It'll encourage the HPV to spread to other parts of your body. Time for our bedtime bird.